So we believe the closer you get, the more you see. And that leads us to be able to fund things that have a far greater impact on children's healthcare in Western Australia.
Well, I think this year's been remarkable in that the very high-profile Kids Bridge from the Children's Hospital across to Kings Park was finally open, and it's just such a visible monument to the work that the foundation, the team, the board and all of our donors do. So it's been a really big impact year for the foundation, probably our biggest ever. And of course we've got the hospice coming down the pike fairly rapidly, and that'll be the biggest thing we've ever done.
The foundation this year has had another record year. We've been able to, through the support of our very generous donors, make grants to the Perth Children's Hospital and wider Child and Adolescent Health Service to the value of $8.9 million, our best year ever.
Type 1 diabetes is a condition most people don't even know happens in children, although we have 1,200 children in Western Australia with type 1 diabetes. If a blood sugar goes too low, it can be very dangerous. Children can actually become unconscious and have fits. So huge burden on the families trying to keep the blood glucose levels in the right range.
My name is Jed and I have type 1 diabetes.
Jed was first diagnosed when he was 3. We were advised to pack a bag and head straight to the hospital. They had to take blood from Jed with blood tests, so to do this, he was held down, which was awful. He was absolutely inconsolable for days. The doctors just said that they needed to do something instantly, and so we were lucky enough to be donated a pump through the Hospital Foundation's pump program.
Insulin pumps deliver insulin minute by minute instead of with injections 3, 4, 5 times a day. And so it takes away that challenge of injecting your child and also allows us to give insulin back in a way that much more closely approximates the way the pancreas used to work before it was damaged.
The ability to give patients this choice is so important because it does empower them with their day-to-day management and the ability to take that on. Having that opportunity and option is life-changing for a family and for a patient.
So fungal infection is one of a big worries for us, particularly for children with leukemia-type cancers. And if left unchecked, they will kill the children. And so they're a big enemy of ours, and so we're constantly looking at trying to prevent them.
He's our life, actually. So, our life goes upside down after diagnosing him. He got fungal infection in his brain, and he forgot alphabets, numbers, even my mom. And I can't describe how we go from last 2 years with this problem.
So the Pacific study is a study to look at how we better prevent fungal infections in children with leukemia. As clinicians, we sort of do research, but in order to actually do meaningful research with sort of large enough numbers and large enough data sets, we really need to have assistance, and without sort of funding from the PCH Foundation for studies like this, they would essentially be impossible to conduct.
These treatments can be harrowing, and if we can minimize the impact, then we can improve the journey that the children have to go through. So we don't just want to cure them, but we want to cure them with the best quality of life possible. So this is exactly the type of study that can change the status quo and change how not only we do things, but how the world changes. That's how we change practice.
We know that probably about a third to a quarter of children are very anxious before they have an anaesthetic. Being anxious makes it a lot harder. It makes you feel more pain, and we know that it can set you up for problems post-discharge, and that can continue for weeks afterwards. So we have a number of things that we try, but most recently we've got the Smiley Scope to help us, and I think it's been a fantastic addition.
I broke my pinky slipping in football training, and I felt some needles going into me, but it was fine because I just kept on breathing in and breathing out like it told me to. I felt really relaxed and calm.
There's no doubt that he was actually very anxious prior to surgery. The use of those VR headsets did make a big difference. The bed was surrounded by doctors and nurses and the anaesthetists there. And on placing the headset on Lucas, it instructed him obviously to breathe. In doing so, it calmed him down. I did find it quite effective and taking his mind off what was going on around him.
We've rolled out in theatre and we've been using it with the immunology department for skin prick testing. It's been very handy there. I believe they have some in ED and they've been using it there obviously for children who need IV access and blood tests done. But ultimately I think we should roll this out to the entire hospital.
So for such a small cost item, it's made a huge impact, a really big impact. But the cost would have been preclusive that we couldn't have afforded it ourselves out of our operational budget. So little projects like this make a huge difference to us.
The Vivo is a high-definition ultrasound machine and we're very lucky to have it. It's extremely important to the interventional radiologist team. It is able to be used in all wards, on all patients, it's mobile, and one of the areas which it is most useful is in the intensive care neonate ward on all the very small babies.
Well, what this equipment's allowed us to do is to be at the very forefront of ultrasound imaging in children in the world, really. I mean, we're going to be able to do things that other places just can't do. The beauty of this system is that it allows you to get extremely high definition pictures of very, very small structures. So we're talking about things that are less than 1 millimetre in diameter, giving us much more confidence in the diagnosis of certain conditions, particularly in small children. For us to get the funding for this has enabled us to introduce this new technology and prove it as we go along. It's painless and it's safe and it's very user-friendly for children.
Ultimately, the Vivo helps in the diagnosis of patients and helping them return home sooner.
To you, our donors, thank you very much for your incredible support. We certainly couldn't have done it without you, and we look forward to more record years where we collectively can have a major impact on the healthcare of children in Western Australia.